Now to the latest on the coronavirus and news that Arizona, like much of the country, is in the middle of a surge of cases. Just under 1,000 confirmed cases reported to the state today. It's a pattern we've seen develop over the last few weeks. We haven't seen reporting this high since mid-August. Medical experts tracking the virus are concerned. Some state leaders, including Governor Doug Ducey, meanwhile, joining President Trump at this rally in Prescott Monday with few masks and not much social distancing. It's unclear when the governor will address these rising cases. So what does all this mean for your family? And what, if anything, will be done? Reporter Nicole Grigg outside the governor's office tonight.
The governor has ditched his formal COVID-19 press conferences. The last time he held one was at the end of September. So we're asking if the election is a reason for the silence.
Good afternoon, everyone. Thank you for joining us.
The governor used to give these public sit-down weekly updates on COVID-19 through slideshows at press conferences that would go over an hour. Then the format started to change.
Joining me today are the presidents of Arizona's 3 state universities.
This was the last press conference that was just focused on COVID-19 in late September.
I want to provide everybody a quick update on where Arizona stands on COVID-19.
Now the best chance to hear our governor address the pandemic is at other public events where reporters ask him questions. I asked the governor in early October if the public deserves COVID-19 updates.
Yes, they do. I'm fighting the COVID fight every day.
But the only ones we're hearing sound the alarm publicly right now are experts like at Arizona State University's Biodesign Institute. They say we are now in the middle of a new surge here in Arizona with hospitalizations and cases rising.
My own recommendation here is don't bring any more than 10 people together at a time right now.
The White House agrees. This week's latest report talks about the new trends and makes clear aggressive communication and mitigation is critical. So we asked ASU's Biodesign director about how quiet Arizona leaders are publicly.
I think in general, for a situation like this, communication is always important. So I would certainly always encourage the more communication we have, the better.
And with cases rising, a big concern is how will it impact our most vulnerable? AARP launching a new data dashboard for cases inside nursing homes that will be updated every 4 weeks. The latest data pointing to concerns over PPE and staffing in Arizona.
My key takeaway is that the majority of or 25% of the facilities are reporting less than a week's supply of PPE. And they're also reporting that there's a 25% of their staff that they're low staffed.
Despite the governor not talking, his top staffers tell me that he's relying on messaging through social media, through ads, as well as public appearances. As for why are we not hearing from the governor? Well, we know that Arizona is critical to the president. A spokesperson pushed back on that, saying it's been a busier campaign schedule, but that does not impact the public health messaging. Reporting in Phoenix, Nicole Grigg, ABC 15, Arizona.